You've just brought your newborn home, and while everything may seem perfectly fine, some very common mistakes during the first few weeks can affect your baby's sleep, feeding, comfort, and even safety. The good news is that many of these problems can be prevented with simple habits that any parent can apply in their daily routine. In today's video, we'll share 5 essential newborn care tips that every parent should know. And make sure you stay until the end, because one of the final tips could help you recognize important warning signs that many parents overlook. Let's get started. 1. Safe sleep comes first. During the first few months of life, the way your baby sleeps is extremely important for their safety. Experts recommend always placing newborns on their backs to sleep, both during naps and at night. Avoid placing pillows, loose blankets, cushions, or toys inside the crib. While these items may seem harmless, they can increase the risk of sleep-related accidents. It's also important to use a firm mattress that fits properly inside the crib, creating a safe and comfortable sleeping environment for your baby. Safe sleep is one of the simplest things you can do, but it's also one of the most important steps in protecting your newborn's health. 2. Learn to recognize hunger cues. Many parents believe that crying is the first sign of hunger. In reality, by the time a baby starts crying, they are often already very hungry and may be harder to calm down for feeding. Before crying, newborns usually show several hunger cues. They may turn their heads searching for the breast or bottle, open and close their mouth, put their hands near their mouth, or make sucking motions. Learning to recognize these early signs can help you feed your baby at the right time, making feeding sessions more comfortable for both you and your baby. During the first few weeks, it's also important to monitor whether your baby is feeding regularly and gaining weight appropriately. If you ever have concerns about your newborn's feeding habits, consult a healthcare professional. Before we move on, if you're a first-time parent, don't forget to check out the free newborn guide linked in the video description. It's packed with practical tips that can help you feel more confident and prepared during your baby's first months at home. Now, let's continue with another essential newborn care tip. 3. Take proper care of the umbilical cord. The umbilical cord stump usually takes a few weeks to dry out and fall off naturally. During this time, it's important to keep the area clean and dry. Avoid covering the stump with the diaper. Whenever possible, fold the top of the diaper down to allow air to circulate around the area. It's also important not to pull on the cord, even if it looks like it's about to fall off. It should detach naturally on its own. If you notice significant redness, swelling, a foul smell, or a discharge around the area, contact your healthcare provider, as these could be signs of an infection. 4. Diaper changes and skincare. A newborn's skin is extremely delicate and requires special attention. That's why it's important to change diapers whenever they become wet or soiled to help prevent irritation and diaper rash. During diaper changes, gently clean the area using warm water and soft cotton pads or baby-safe wipes. Make sure the skin is completely dry before putting on a fresh diaper. If you notice redness or signs of diaper rash, speak with your pediatrician about appropriate protective creams or treatments. These small daily habits can go a long way in keeping your baby's skin healthy and comfortable. 5. How to bathe your newborn safely. Many parents feel nervous about giving their newborn their first baths, but with a few simple precautions, bath time can become a calm and enjoyable experience. Before you begin, make sure everything is ready, including a clean towel, fresh clothes, a diaper, and baby-friendly hygiene products. The water should be warm, never hot. During the bath, hold your baby securely and gently wash each part of their body. It's not necessary to bathe a newborn multiple times a day. In many cases, 1 bath per day is enough to keep your baby clean and comfortable. After the bath, carefully dry all skin folds and creases to help prevent irritation and discomfort.